Well, shifting to your Capital Connection, Governor Glenn Youngkin recently signed a law changing how people can access medical cannabis. Now, it doesn't take effect until July 1st.
And here with us now to tell us about this change is Judy Jenks, nurse practitioner in the New River Valley and owner of Clinic420.info. Judy, thanks so much for joining us today.
Oh, thank you for having me. It's good to be back on WFXR TV News to talk about medical cannabis.
Now, Judy, you have been busy connecting patients with medical cannabis. One part of the process is being removed. Can you explain the change in the state law to our viewers and how it will impact them?
Yes. So Governor Youngkin signed Senate Bill 671, which removes his requirement to apply and register for medical cannabis with the State Board of Pharmacy. This eliminates that need to pay $50 processing fee also. And if you think about it, we prescribe a lot more dangerous medications than cannabis, and people are dying by the hundreds of thousands of opioids. But they don't have to register to the Board of Pharmacy. They don't have to pay $50. They don't have to carry a card saying they're okay to take opioids. So Governor Youngkin was very progressive in signing this bill.
And Judy, this bill, as far as we understand it, also gets rid of that 60-day waiting period, correct?
Absolutely. And it was longer than 60 days. Many of my clients were waiting 90 to 100 days to get their card. And that's a long time if you're in pain or cancer treatments or facing end-of-life illness. The process was clunky. It was hard for patients and us providers to navigate the system. But starting July 1st, all you'll need is a certification document from a healthcare provider who is licensed by the Board of Pharmacy to evaluate for medical cannabis use.
Well, we want to revisit a question that we asked you last year about adults in Virginia. Now, they can grow their own cannabis or obtain it through other means, but what is the difference in the quality and what you get at a dispensary?
So growing your own and buying it illegally is a bit of a gamble. It's not as easy to grow as you would think. It's not quite like growing tomato plants. Obtaining the seeds is hard because you can't sell the seeds in the United States. It's still illegal. And you don't know what strain of cannabis you're getting, and is it the strain you need for your health conditions? The dispensaries in Virginia grow their own plants and make their own products. They get inspected by the state. It's structured. They use Tyvek suits when working with plants to prevent contamination. They're not allowed to use pesticides unless they're facing a catastrophic crop failure. You get a packaged products with listed ingredients, much like buying a medication over the counter, except this is all organic.
And real quickly, Judy, where can people go to learn about applying for a medical cannabis license?
Visit my clinic, www.clinic420.info, or you can email Jenks, Jenks, at clinic420.info. We are the first medical cannabis clinic in Southwest Virginia and the second nurse practitioner run medical cannabis clinic in the state.
All right, Judy Jenks, nurse practitioner in the New River Valley. Thanks so much for taking time out to speak with us today.
My pleasure.